In Utah, in the state of Utah, the good people of Utah put a ballot initiative on their ballot, which was, yes, we're going to take the Medicaid expansion. Keep in mind, you know, the federal government pays, I think, what was it, 90% of it. The state only has to pay 10% of it. We're going to take, in fact, I think the federal government pays 100% of it the first 3 years, although I'm not sure if that 3-year window has shifted or things have changed. But this is how it works, right? And so the voters of Utah put this on the ballot and voted it in. You know, the legislature wouldn't do it. The governor wouldn't do it. They're all Republicans. So the citizens of Utah said, we want the Medicaid expansion. It's going to give health insurance, the ability to get low-cost health care or no-cost health care to 150,000 people in Utah. To do that, it's going to cost the state nothing for the first couple of years, but they say that it's going to cost around $10 million by 2021 and $65 million by 2024. Okay, so keep that in mind. $10 million, like a couple of years down the road, it's going to cost the state of Utah. Utah has right now a $1.2 billion surplus, $1,200 million, $1,200 million, right? It's got a $1.2 billion surplus. And the Republicans who run Utah are saying, we're not going to put into law this thing that the people just voted on. There's legislation to completely repeal the ballot initiative. There's legislation to impose work requirements like they've done in, you know, a number of other Republican-controlled states. You must work if you're going to get Medicaid. There's a bill to cap enrollments. There's only a certain number of people who can get it. There's a bill that would lower the income thresholds so fewer people qualify. I mean, 4 different specific pieces of legislation in Utah right now where Republican legislators are saying to the people of the state, tough luck. You know, you guys voted to have health care for everybody in Utah, and we're going to take it away. Now, I suppose this isn't all that surprising. I mean, this is what Republicans have been doing, right? I mean, the whole Tea Party thing was, we don't want no stinking health care. But the question in my mind is why? You know, I'm wondering, is there an answer that's not, you know, the facile answer of, well, Republicans are stupid, or Republicans don't think that people should have health care, or Republicans think that if people don't earn their health care, they don't value it, or if they don't pay for it, they don't value it. Or is it that Republicans like the fact that when people use the emergency room as their primary health care, that they're more likely to get really serious diseases that ultimately kill them? And, you know, they're not going to get checkups. And I mean, you walk into the ER and say, I think I've got a bump someplace or a lump. And they're like, you know, come back when you're bleeding. Right? It's emergency care. So maybe Republicans like the fact that people not having health care actually drives up health care costs. It ends up being, you know, if you follow the theory that, or the reality, that every cancer diagnosis adds about $500,000 to the GDP of our country, because, you know, there's all the stuff that goes with the cancer diagnosis and cancer treatment and all that kind of thing. Of course, that's ignoring the lost wages, lost work, the lost productivity. But why are the Republicans in Utah doing this, in your opinion? Why do you think they're doing it? Do you think that they're doing it because they're evil? Do you think that they're doing it because they hate poor people? Do you think they're doing it because they've got some bizarre ideology? Does it have to do with their Mormonism? Except that this is not unique to Utah. I mean, you know, a number of other states have done the exact same thing, or something very close to it. The Republicans in other states. Why do Republicans not want Americans to have, or in the case of Utah, Utahans, to have health care? Why? I don't get it. Do you have, you know, it could be a tongue-in-cheek answer, or it could be a straight-up answer. Why? I get, you know, why somebody like the Koch brothers doesn't want anybody to have it, why they funded that, you know, group, the campus group that was doing the creepy Uncle Sam ads and all that. They don't want their taxes to go up. But they're billionaires. It's, you know, the legislators in Utah are not billionaires. I mean, some of them might be millionaires if they're Republicans. But okay, so that's number one. Well, and the second one was, I want to get into it. Actually, I'm going to postpone this until the next hour of the program. There's some just bizarre stuff. I mean, evil stuff going on right now in our internment camps here in the United States. We've got 48,000 people being held in internment camps right now. And we're going to get into that in the next hour. But anyhow, it's Anything Goes Friday, so I'll stop my riffing, and we'll see what you have to say. Josie in Rockwell, North Carolina. Hey, Josie, what's up?
Hey, I have Alan Grayson's answer to your question.
All right.
Which he stated very succinctly in Congress not too long ago. It's the Republicans' answer to health care. Don't get sick on one side of his poster, excuse me, and on the other side it said, if you do, die quickly.
So,
and I don't think their goals have changed.
So you're suggesting that the Republican legislators in Utah are fighting the expansion of Medicaid because they want people to die quickly?
Yes, and not just in Utah, in North Carolina, and from sea to shining sea.
Yeah.
And especially Democratic voters and citizens.
Oh.
But they're pretty much even-handed. If you're old and ill,
right?
Because he was aiming at, the Medicaid, Medicare age group when he was speaking.
Right.
Because he's Floridian. He knows his troops. But I think he was speaking also to all Americans.
But a lot of it, I mean, Utah's a mostly white state, and this mostly hits people in their 20s and 30s who have the lowest wages in this country. And, so it's hitting the white working class in Utah in a big way. I mean, they want them to die early?
I don't think they care. Do you?
Well, that's the thing.
Melania's coat.
Yeah, I don't really care, do you? I get it. I just don't see the advantage to them. But, well, okay, it's a start. Josie, we got a bunch of other people who want to weigh in on this. Thank you for the call. Great to hear from you. I appreciate it. Dave in Santa Monica, California. Hey, Dave, your thoughts?
Hey, Tom, I think that the Republicans don't want people to have health care because any kind of government-supported health care, because they can't afford to have people see the government as positive, as doing good things for them, because then their whole ideology falls apart, which is basically the government is bad, the private sector is the only good.
Right, and where that goes is if people believe that the government is a force for good and the government can do good things, then it's justified that the government would be inspecting the refineries that the Koch brothers and the other right-wing billionaires run and dialing back on their pollution and things. And we can't have that. That's going to reduce our profitability. Is that your point, Dave?
Yeah, exactly. And also, the privatization of schools and the privatization of roads and, anything else that they want to put their mitts on.
Oh, they're even pitching the privatization of fire departments now and the post office. They want to privatize the post office or profitize or whatever. Yeah. Okay, Dave, that's a possibility. Thank you for the call. Carrie in Chicago. Hey, Carrie, you've got a suggestion?
Hi, okay, so I've studied these people for a long time. And there's no rational discussion to be had with them. They are a cult.
So, but even a cult, I mean, Scientology, for example, believes that 10,000 years ago, people from the planet Xenu came here to this planet and discovered a whole bunch of, Neanderthals and people running around loose who weren't, all that bright. But there were some really smart people, and so they dropped off some of their folks, and they said to everybody else, we're going to come back in 10,000 years, and if you've got a lot of people who are clear, who are enlightened, then we will pick them up and take you back to the planet Xenu. And that's why the Scientologists are always trying to get clear, right? They're telling all their secrets to the auditors so that they can become pure and go up into the spaceships. There's actually an ideology there. So what is the ideology of the Republican cult?
Well, the ideology, if you want to ask me, all roads lead to racism. However, I'll use another example, one that might appear less benign, or more benign, I should say. I used to do some tax returns for Amway distributors. Mm-hmm. And I would look at their returns and I'd say, you're only making about $500 or $600, and you're paying $10,000 in this crazy motivational crap.
Yeah.
And I got fired. They wouldn't even listen to that.
Yeah. Well, you know, Amway is Betsy DeVos's thing. That's her, you know, her husband's family became billionaires on Amway. And you know, I always considered that and all the other multi-level marketing things are basically what you're doing is turning all your friends and relatives into customers as just a sucker's game. But Kerry, thank you. Republicans are a cult. If they're a cult, you know, what is their core belief? Well, Kerry says race, but in Utah, you know, cutting Medicaid is mostly not a racial issue, I'm guessing. I mean, maybe it is, but I suspect not.